You know the saying, there's an app for that.
Really? And one of the hottest areas for apps these days is health and wellness, but CBS 2's Dr. Max Gomez is here to tell us, patient beware. Doctor.
Yeah, that's right. Many patients are relying on these mobile apps on their tablets and smartphones, partly out of convenience. They can save a trip to the doctor's office, and partly because they can monitor chronic conditions and relay the information to your doctor. Trouble is, they're often inaccurate.
And then I turn it on.
Every morning, 88-year-old Milton Meisner checks and records his vitals like weight, temperature, and blood pressure using his iPad.
Now it is transmitting.
His stats are instantly sent to his doctors through an online app.
And the numbers are accurate. You can't fool around with the numbers.
Milton's healthcare app, approved by physicians at USC's Keck Medical Center, works the way it should. But Dr. Leslie Saxon says that's not always the case.
We see applications that run the gamut. Super responsible, great applications, and applications that don't do anything near what they claim to do.
Right now, there are more than 165,000 health and wellness apps available on your smartphone or tablet, but only a fraction of them have been validated by the FDA.
The FDA has approved over 160 regulated medical applications.
Dr. Saxon says many other apps on the market today haven't been tested enough for accuracy, and others have gone entirely unvetted. A study from Johns Hopkins University found one popular blood pressure app gave measurements that were flat out wrong. It's been pulled off the market.
If it looks too good to be true, it probably is.
Dr. Saxon is now part of an FDA panel working to develop global guidelines and regulations for healthcare apps. Doctors say you should consult with your physician if you plan to use an app to find out if it will benefit your health care. Now, even though the FDA does not require approval for mobile medical apps, at least not yet, the agency does have a list of the ones it has vetted. Go to cbsnewyork.com for the link to the right page on the FDA website. But always check with your doctor before relying on an app, and never use an app for your primary diagnosis or treatment. Don't rely on a diagnosis you're getting off your smartphone.
That's the truth.
Yes,
Thank you, Doctor.
Thank you, Dr. Max.
And